Our children should not have to live in fear that they are going to get shot if they go to school.
That was U.S. Surgeon General Vivek Murthy declaring gun violence a public health crisis in the United States. This advisory by the nation's top doctor comes as the latest data shows firearms are the leading cause of death for children and adolescents. We want to welcome in Fairriona Magee. She is a public health reporter on gun violence for the Trace Public Health Reporting. Now, Fairriona, when we heard this announcement about gun violence being a public health emergency, it came almost in tandem with another public health warning about social media. Gun violence is something that has been persistent and awful in this country for quite a long time. What is happening right now that requires this declaration, and what, more importantly, what does it do?
Thanks so much, Tom, for having me. I mean, this is really, really important. I think that this news really comes in the wake of CDC data that show that firearm violence is the leading cause of death for children and teens. And when we think about this is important for a multitude of reasons, right? An advisory is one of the most significant resources that the Surgeon General office has to really bring public awareness to public health issues. And we think about historically how past Surgeon General publications have really shifted and been a catalyst for public health issues like cigarette smoking in the 1960s, right? And this was during a period of time where a large percentage of people were still smoking cigarettes regularly, but that publication really brought attention to it. And I think even on a larger front, what it represents historically for gun violence is really, really important, because when we talk to researchers who have been at the forefront of this research for decades, a lot of the political polarization that led to obstacles for them to get their research published or get the funding has led to a dearth of research. And that is why this is really, really an important advisory in an important moment that is taking place, because where we're really seeing that there's a lot of ripple effects that are taking place because of gun violence.
But I want to drill on what this would do, because if you're using the example of cigarettes, if somebody takes a cigarette and put it in their own mouth, they're the ones making that decision to smoke that cigarette. The Surgeon General decades ago identified cigarettes as being hazardous to people's health. But when you apply that to something like gun violence, if you were the victim of an attack, how could a Surgeon General's warning prevent something like that?
Yeah, that's a really good question. And what it really does is bring awareness to it, right? Because one of the things that the advisor really did, it laid out the scope of the issue and the ripple effects. And also, too, it really detailed how this is a uniquely American problem. It detailed things about how you can use safe storage practices, and it could really be important to prevent gun violence. And it also talked about how suicide risk is in tandem to access to firearms. So for the general public, what it really does is just bring awareness from the top nation's doctors into how this is such a huge issue. And for individuals who may not be in spaces where they have those resources, it really puts it in the forefront, and it really shapes the conversation to be a more public health conversation compared to a criminal or a law enforcement conversation that had been in the past.
One of the concerns about this from gun advocates have been that if you look at the history of the Surgeon General's warning, again, going back to the cigarette example, at one point the heads of the cigarette companies wound up on Capitol Hill and eventually had to enter into massive settlements as a result of the harm that was caused by their products. Could this be opening up the door to a similar kind of thing for gun manufacturers?
So one of my colleagues, Trip Brownlee, actually had the opportunity to speak with Dr. Murthy, and what they talked about is that the political conversation is really, really not helpful in this space, because if gun violence is the leading cause of death for children and teens, we really have to focus on preventative strategies to curb that. It is not something that we kind of focus on in terms of what manufacturers will have issues with, but we can really talk about evidence-based approaches that are going to be able to really stem what we're seeing on the ground level, right? So the manufacturer piece may be a concern, but one of the things that was really, really great from the advisory is that it really talked about research and evidence-based models, and not necessarily how manufacturers really have to navigate that, but what we could do from a public health perspective to really curb that.
Fact of the matter is, though, those tobacco settlements did fuel a lot of anti-smoking campaigns, which has led to dramatic drops in cigarette usage across this country. Fairriona Magee, thank you so much for joining us today. Talk about this declaration by the Surgeon General.
Thank you so much for having me. I really appreciate it.
Good to